Hi everybody, I'm Dr. Joseph Cipriano, and today we have a patient here. Now, as you're telling me, from moving, you really just tweak something?
Yeah, really bad at my shoulders.
Okay, so he did lose his voice, so you can bear with him a little bit on that. But so right now, as you told me, it's going where you're feeling pain is on the right side of your neck, kind of following that trap muscle into the shoulder here. Then on the left side, you're feeling pain underneath that scapula on the left side. And then you've always had the low back issues.
Correct.
Okay, so those are going to be the main three things that we're going to be dealing with. So right side of neck, and it radiates down. Does any pain ever radiate down into the arm or hand?
Not recently. Usually I get lower pain in my legs.
Okay.
From my pinched nerve in my lower back.
Okay, so he does have a pinched nerve in the lower back. And does it go in both legs or just one?
Usually it's in my right leg, so it's almost like a
sciatic nerve?
Yeah, that's what I'm thinking it is, a pinched sciatic nerve.
Okay, how far down does that go?
It usually goes right down to my foot, to my heel almost.
Okay, alright, so pinched nerve in that low back, right side trap, and then left side underneath that bottom port, that inferior angle of the scapula. So those are going to be the three things that we're going to work with. What I want to do, I want to put you through some ranges of motion first.
Okay.
First, I want you to just look all the way down for me.
Sitting down or standing up?
That's fine, sitting.
Okay.
Any pain with that?
No.
Alright, if you look all the way up at the ceiling, any pain with that?
No.
If you bring one ear to one side, any pain with that?
No.
Other side?
No.
Okay, and then if you were to look over each shoulder, any pain with that?
No, just very, just pretty much tension in my back.
Tension? What about the other side?
Nothing.
Nothing? Okay. I'm gonna have you sit up nice and straight. I want to push down. Does that increase any pain?
No, no pain at all.
Okay, good. We're gonna turn your head to the left. Any pain with that?
No.
Okay, and then to this side. Any pain with that?
No.
Okay, good. This time I'm gonna have you stand up.
Okay.
If you are to bend forward at the waist, any pain with doing that?
No.
If you're to come back like this, any pain with that?
No.
If you're to come down to the side,
No.
any pain there? Other side?
No.
Okay, and then if you're to rotate, any pain with that?
No.
Other side?
Just stiffness, that's all I feel in this. And a little bit of pain right here, but it's because from the injury last night from moving.
Okay, so now last night when you were moving, what did you do, just so people know?
I was carrying a box. Picked it up like this with my knees, obviously, and I slipped. But it had valuables in it, like glassware, so instead of me letting it drop, I extended it forward, causing this to pull out.
Gotcha.
So,
Okay.
that's pretty much what happened last night.
Gotcha. Okay. And then, so you were hunched over, you were in so much pain,
I couldn't walk, and that's when I called you. I was hunched over. I couldn't walk for probably about 8 hours.
Okay.
And I had to take a hot shower bath, and then after I fell asleep for an 8 hours and the rest of bed at night, it alleviated a little bit, but I still had that existing tension and a lot of pain still, like a little bit of a headache coming up through here. So I knew it was like a tension headache kicking in on me.
Okay.
Okay.
Yep, so what I'm going to have you do, I'm going to have you lay face down for me. Okay. So how I'm going to start every adjustment, we're going to scan the entire body, we're going to check that right side to the left side, really looking at that symmetry here. So first, just starting to palpate in the neck, and we're feeling either side. Get up. A little bit, do you notice that when I push in here?
A little bit, but it's not like sharp pain. It's more or less like, it's not a very hard pain.
Okay. Alright, yeah, just the misalignment that I'm feeling on that right side. So, granted, good that it's not causing any pain, but it still can be putting a little bit of pressure on those nerves there. Okay. Yeah, now going through the traps here, right into there, that I'm feeling quite a bit compared to the left side. Okay. So from the cervical spine, we're going to go into the thoracic here. Now, let me know if anything that I'm pushing on, if it does cause any pain for you. And now, as we're coming through the thoracic spine, okay, under here, this is where you have pain on the left side, correct?
Yes, but right now you're hitting it, it's not hurting.
Okay.
As you've been pushing, I can feel the tension dropping down, like right around here. I feel the tension now.
Okay, I feel tension.
Yep, dropping down.
Okay, so that means when I'm going through the thoracic spine, he's feeling pain as I'm coming into this lumbar spine in through here.
Mm-hmm.
Okay.
Right there.
Right there?
Yep, just a little bit of pain. It's not sharp or hard pain that'll, warn me of anything, but
Okay.
it's very dull, like very light pain.
Does it stay there? Or do you notice it going into the leg?
No, not noticing it going into like just stays right there.
Okay, so pain staying right there.
Correct, sir.
Okay, so now we're going to come into the SI joints. If I push it on this right side, any pain with that?
No,
Any pain directly over the sacrum?
no,
Any pain over the left side?
no.
Okay, good. Alrighty. So, looking at the patient, a little bit of structural imbalances that we're going to focus on. And then also, especially right through here where you are noticing a lot of pain in that area. So what we're going to do first, we're going to be doing the Hypervolt. It's a portable massage device.
Okay.
We're just going to relax everything. The reason we're going to do that is one, I want your muscles to loosen up just a little bit so it's easier for me to make an adjustment.
Okay.
But then also I want that adjustment to hold longer on you.
Correct.
Now, how does it feel when I go over that spot?
I feel a lot of the tension, like a little bit of pain, but nothing sharp.
Okay, good.
Very light.
There we go. How'd that feel?
Awesome.
Good. Okay, so what we're going to do, we're going to start the adjustment up top in the cervical thoracic area, and then we're going to make our way down from in here. So we're going to start right here on that left side, right at that T1. And you felt that one pull.
Yeah.
Okay, we're going to drop down a little bit here. T2 on the right.
Oh, I thought that got out to my arms.
Did you?
Yeah.
Good.
Tingliness in my arms just went through that.
Okay. So I'm going to have you take a deep breath in. Exhale all the way out. One more time, deep breath in. All the way out. Good. I'm going to do one more here. Deep breath in. All the way out. Good. Okay. Alright, let's come down here. Let's check out that leg length here. Alright, so he is left short. So there's one thing that we're going to keep up and always pay attention to. So he's left short on that leg length. One thing that I really want to do, just because we're having a lot of issues right in through here, and I'm seeing this right side being raised up a little bit, I want you to sit up on the table for me.
Sounds great.
One leg on either side.
Okay.
Yep, just like that. Okay, so I'm going to have you cross your arms over your shoulders, good. I'm going to turn you as far as you can this way. Now with your thighs, just kind of keep them squeezed to the table. And I want you to look as far as you can over your left shoulder.
Oh my God.
How'd that feel?
Amazing.
How's that spot feeling?
A lot less tense.
A lot less tense?
Yes.
Good. Perfect. Alright, lay face down again.
That's good.
Okay. Coming in, still left short on that leg length. What I'm going to do, I'm going to check your sacrum here. So I'm going to stabilize right here. I want you to raise this leg up as high as you can for me. Any pain, tenderness, tightness with that?
No.
Alright, relax that side. Raise this side for me. Any pain, tenderness, tightness?
No.
Okay. They've both been up about the same, which is a good thing. Okay. I'm going to have you lay on your side and face me this way.
Face that way?
Yep.
Okay. Was my arm underneath your grip? Or hanging this way?
Yep, hanging that way.
Okay.
So I want you more on your side.
Okay.
Good. Oh, you're good. I'm going to bend this top knee. Good, just like that. I'm just going to... There we go. Roll you around a little bit. There we go. How'd that feel?
Good. We'll go back the other way?
Yep, flip to this side for me.
Okay. Oh, that one was a pain, wasn't it?
It was. Nope, I want you to flip on your back this time.
Okay.
Okay. So now we're going to go through, I want to check that leg length again. Actually, if you want to come on in. So at that leg length, tiny bit short still on this side, but not by much. Actually balancing out a lot better. We're going to do some leg pulls. Now with the leg pulls, you may feel release in the ankle and the knee are going all the way up to the hip as well.
Okay.
Good.
Oh, I felt that one.
Come on up for me.
Alright.
Good boy. Okay. There we go. Alright, I want to do a little bit more work on the thoracic spine in here.
Okay.
And then we're going to do more work, especially on that neck.
Yeah.
Okay. Let's go ahead. Let's clear out a little bit more of the thoracic. So what I'm going to have you do, I'm going to have you stand up
Okay.
and face that way for me. Yep. I'm going to bring your arms out by the side. I want you to put your hands up and over mine like that. Yep. So I'm going to lean you back onto me.
Mm-hmm.
Squeeze your elbows together. Okay. So you got to do this a little bit different. You're going to move that well from here.
Okay.
All right. Take a seat for me.
See, gotcha.
Face that way. Yep. Okay. There we go. Alright, so I'm going to have you give yourself a big hug. From here, I'm going to have you take a deep breath in and exhale all the way out.
Oh,
There we go.
that one was hard.
There we go. That took a minute, but we got it. Alright. So now on the neck, let's see here. So I'm just going to feel how your neck is rotating. I'm just feeling the vertebra. Just if I notice any catching on either side, just want to get a little bit of movement in here. Good. There we go. Not a whole lot of movement, but we got a good amount. I know you felt that release too. Okay.
My headache's almost gone.
Is it?
Yeah, my tension headache, yeah, it was creeping in the back of my head. Yeah, it's almost gone.
Good. Yeah, that alignment right there is one that'll definitely help. And then what we're gonna do with the Y-strap. So this is just gonna, you'll notice, probably take it completely away. So let's go ahead. What I'm gonna do, the strap is gonna go around base of the occiput. I'm gonna have you just lay back, keep your knees bent off like that.
Oh, keep my lead back, correct?
Yep, keep the knees bent. Come on back just like that. And then from here, what I'm going to be doing, I'm going to distract in that Y-axis direction. And we're going to get a very powerful decompression going all the way down.
Oh, that just released that. Can't breathe now. It literally decompressed what I heard last night. Felt that just pull right out.
Pulled it right out?
Yeah.
Relax just for a moment. How'd that feel?
Oh, I've been wanting that since last night. I wanted to noose myself and hang myself to get myself up. To get it out. Oh man, it felt great.
There we go. Yeah, you felt how that just decompressed. Yep. Yeah, that manual decompression like that is such a powerful technique. And I mean, even with how you're saying, you know, that injury, and then even with you telling me before how you had the cervical pump.
Yeah.
That help bring that traction up in your neck like that, which those are good. They do very well, but can you tell the difference between this two?
Definitely.
Yeah, that's the only thing why, you know, when people are on those, they are great, but
That works a lot better.
Yep. And you get that instant like that.
Decompression is not like with that, it just stretches it out,
Yep.
and you don't feel the decompression
Yep.
actually happen. It just happens over time.
Correct.
You know?
For this, you're feeling that thing
Instant.
one instant. There we go. How are you feeling?
Amazing.
Okay. Kind of move around a little bit. Do you notice a difference?
Yeah, I don't notice as much stiffness. I still feel a little bit of soreness, but that's okay.
Where at?
Yeah.
Are you still this one under the
Yeah.
left? Yeah. Just what I'm gonna think a little bit with that is a little bit more of a muscle pull with that one.
Correct.
What I would do with this is a little bit of icing. Ice 20 minutes on, 20 minutes off. Just with that, the fibers are a little bit
Sore still.
Yep.
And stretching, I've been doing a lot of stretching just to kind of help it.
Yeah, that one is going to be with a lot of the fibers there. But now that everything is realigned in the spine, especially in through here, any headaches, anything like that anymore?
Right now I don't feel it's kind of, after that Y-strap, it kind of helped the headache disappear now almost.
Yeah.
To a T.
Yep. So no more tension in that neck, how you had. No, that's amazing.
It's just minor tension, but not as much as I was experiencing before when I came in.
Good, good. What I want to do, just because you feel a little bit here, I want to do a little bit more with that hypervolt.
Okay.
Just on that area, just.
Okay, want me to lay back down on my back?
Yeah.
Okay.
Or on your
Stomach again on my back.
Yeah, let's do that a little bit more, just so we can get this area a little bit more relaxed. Because I know you do have a drive.
Yeah.
You know, you came from pretty far. So let's help out with this, and then also, yeah, when you're at home, definitely do some icing on that area. That'll really help a lot too. Yeah. So what happens, especially when you're overstretching out, you can pull. You can even pull a little bit in the rhomboids, right in between the scapula, and you're pulling that. All those muscles down through here, so, I'm not trying to go deep in with this one. It's more just like lightly going over the top, just to help relax the area. I'm not really trying to do like a deep tissue or anything like that, just more of an overall relaxation for me. How's that feeling?
Amazing.
Okay, good. Yeah, you can tell I'm not like pushing in or digging deep.
No.
Perfect. There we go. How's that feeling?
Amazing.
Good. Alright, going up. Perfect.
Stand up, sit down.
No, you're good. You're good. Yeah, how you feeling?
Yeah, better, a lot better than before. Yeah.
How would you describe that Y-strap to anybody who's never had that done?
Like something you never felt before. A decompression that you never felt. Honestly, it's a sense of relief that you have. You don't feel the pain anymore in your neck. No, I don't feel the headache. I don't feel as much tension as before. When I came in, I couldn't really move my neck all the way this way, all the way that way. It was more or less I had to actually push it.
Mm-hmm.
Now I could just do it without a problem. It's easier for me to look to side, and I can actually move. Before I couldn't move. I couldn't really stand up straight. I was more hunched down. You know? So I feel a lot better with that Y-strap. They did a good job.
Perfect.
Great.
Good. I'm Dr. Joseph Cipriano, everybody. I can't talk anymore. But yeah, another happy patient here, and definitely if you're ever back in the area,
Yes.
I'd love to have you back on in here.
Sounds great.
You know, and then obviously to do a follow-up, make sure everything is holding well, make sure that this injury has also kind of alleviated a little bit. Those are things that, you know, I want to make sure and see.
Okay.
Make sure that you're healing and getting back, you know, to your proper health.
Okay, perfect.
Perfect. If anyone is looking to schedule an appointment, just go right to my website at drjosephcipriano.com. I'd love to get you scheduled in. Have a good one, everybody.